Hi, this is Amy, and Amy's been nice enough to let us do a little demonstration on Restylane lip enhancement. Restylane being a stabilized hyaluronic acid gel filler, which we find is our filler of choice for the upper lip. It's, in my personal opinion, of the Restylane gels, it's the softest and most pliable, giving, in my opinion, the softest result. Some of the things that we look for is when the patient comes for consultation regarding lip enhancement is really a lot of typical features of the lip architecture, and most notably what we're looking for is we're looking for a natural sweep of the upper lip with some semblance of a cupid's bow, the area where the lip kind of goes up towards the nostril. We're looking for the degree of prominence of the what we call the philtral depression. That's the area between one bow and the next bow coming down in the middle. And then we're looking for the sweep and any asymmetry that exists between the left and right side of the lip. In the absence of those architectural features, we oftentimes are a little bit compromised in the kind of look that people can get with the use of these filler materials. The more prominent, the more defined these architectural features are, the nicer the lip enhancement that we can provide for the client. So we're going to go ahead and get started here, and we're going to do a little local block of the upper and lower lip area, get Amy prepared for the Restylane product, and then we'll show you the technique that we currently are using. So Amy's all numb. We've numbed up the inside aspect of the upper lip and lower lip. We keep the volumes to a minimum so that she doesn't have a lot of distortion of the lip volume, so that it really gives us a better sense of what our endpoint's going to be. And what Amy and I discussed ahead of the procedure was we're really trying to enhance the actual architecture of the lip line. We're going to enhance the area right along the upper lip line, cupid's bow, depression, opposite cupid's bow, and along the upper and lower lip line. This really gives the illusion of having a larger lip without actually placing a lot of lip volume, product into the actual lip itself. And then we're going to come back and we're going to put a little bit of volume to give a little bit of extra pout to the mid portion of the lower lip and to the mid portion of the upper lip. I think one mistake that's made with the injection of these products is injecting uniform amounts of product from the mid aspect of the upper lip to the outside corner. The lip actually has a very natural taper, being more full in the middle and a little less full from side to side. So we're trying to preserve some of those normal, pretty anatomical features. So, enhancing the lip line, we take a little bit of the product and we go right along the lip margin. And then we're going to go from one bow right across to the other. And I'm going to come across the table here. Get this opposite, sorry, Amy. And that gives us a real nice enhancement just to the upper lip area. For those patients that need it, we'll oftentimes take a little bit of the synthetic product and we can take advantage of accentuating what we call the philtral column. These are these two raised ridges of tissue heading from the base of the nose down towards the upper lip. Amy has nice volume in those areas, and so unnecessary in this patient. And then on the lower lip, we're going to do a very similar injection. We're going to start here in the middle, and then work our way across, kind of enhancing the lip line. Doing a little bit more in the middle than we do on the sides. Come across and get this opposite side for Amy. And I usually just do just a little bit of massage to make sure that the product is uniformly distributed along the lip line. Gives her a real nice definition of some of her normal, nice architectural features. And then we're going to put a little bit of volume into the lower lip just to provide that tiny bit more volume. And the areas that I like to inject is that junction between the dry part of the lip and wet part of the lip. I think it's a little bit of an error to go completely into the dry part of the lip, and certainly more of an error to go just into the wet part. We're staying with very conservative volumes here. Amy and I discussed it ahead of time, and she has nice lips to begin with, and we don't want to change any of those features. Again, looking for the junction of the dry part of the lip, wet part of the lip, providing a little bit of extra volume to that location. And the last thing we want to accomplish is a tiny little bit of Botox. I use somewhere in the neighborhood of about 5 units of Botox placed in 4 separate injections along the upper lip roll. And I think what it provides for us, and especially in the client who's deserving of it, it provides a little bit of eversion of the upper lip margin, giving them again a little bit of more upper lip show in the absence of actually putting in any extra lip volume. So we're going to do a couple injections. A couple on that side. And we'll do a couple more over here. Give one last feel of symmetry of the product. Take a good visual look. And wipe a little bit of the excess. A little tiny bit of bleeding that Amy had. And there we are. I'm going to sit Amy up a little bit so you can get a little bit of a better view. How's it feel, Amy?
Fine.
And there we are with the enhanced product.